How can you differentiate between joint effusion and tenosynovitis on your MSK ultrasound exam of the hand when fluid is visualized on the volar surface of the finger? Joint effusion will be visualized on ultrasound as an increased amount of fluid seen within the joint capsule overlying the articulation of the two bones that form the joint. It's normal to have a small physiologic amount of fluid present within a joint. Effusion will be compressible with transducer pressure, and there will not be any hyperemia present when using power Doppler. It's synovitis where you'll see hyperemia present with power Doppler. That's because it's actually an inflammation of the tissue and it's increased blood flow to that area, whereas an effusion is a fluid collection, so it's going to either be a more simple or a complex compressible fluid collection. A joint effusion can derive from trauma, inflammation, or infection. Tenosynovitis, on the other hand, will be visualized on ultrasound as an increased amount of fluid within the tendon sheath. In this case, it's the tendon sheath that surrounds the flexor tendons on the volar aspect of the finger. There may also be thickening of the tendon sheath and hyperemia present using power Doppler. It's normal to have a small amount of fluid visualized in the tendon sheath. When there's fluid seen fully surrounding the tendons, like in this image, this is indicative of tenosynovitis. Tenosynovitis is considered inflammation of the synovial membrane surrounding a tendon as a result of trauma, repetitive strain, or disease. The synovial membrane that surrounds the tendon is barely noticeable unless there's fluid present. It's important to scan the area of interest in two planes before deciding the diagnosis. It can be difficult to tell the difference between a joint effusion and flexor tendon tenosynovitis when scanning the volar aspect of the finger and the long axis. Although joint fluid is typically seen close to the bone and tenosynovitis is typically seen close to the tendon, it's easiest to determine the diagnosis by doing a sweep through the entire tendon in the short axis from proximal to distal to delineate the precise location of the fluid. If you're interested in increasing your knowledge of MSK ultrasound and perfecting your scan technique, join our hands-on workshop this September in New York City. Virtual attendance is also available this year. It's a perfect opportunity to gain more skills and earn CME. Visit my website, www.learnmsksono.com, for more info. Hope to see you there.